Are you looking for exercises, joint mobility exercises, stretching, strengthening, all that kind of stuff that are going to decrease that stiffness and that spasticity and that weakness and that feeling of being locked up in your hips? Well, I got an entire series that starts just for you right now. What's up, YouTube MS Gym family? My name is Trevor Wicken, and I am the founder and creator of the MS Gym, the largest platform for movement, mindset, and education for people affected by MS and other neurologic conditions. So we release videos on this channel quite often, so make sure that you watch this video, you like this video, and then you go and subscribe to this channel so you don't miss out on all the awesome content that we're going to be putting out that's going to help you counteract your symptoms and live a life by design and not by diagnosis. With that, I encourage you to watch till the very end of this video because I always have some special offer for you that will give you an opportunity to come train with us inside the MS Gym. All right, gymmers, so we're going to start working on pelvic mobility, and the first thing that we're going to want to do here is work on what's called pelvic tilting. So as we walk, as our leg swings forward, one side of the pelvis is going to tip forward and one side is going to tip back, right? So it's going to do this as we walk, okay? It's kind of hard to do that one side at a time, especially when you have stiffness, spasticity, and just muscle weakness and imbalances in your pelvis. So we're going to work on going forward with both sides and back with both sides in this first drill. So I'm going to put this band around my waist so you can kind of get a visual for what I'm looking for here, all right? So when we do an anterior pelvic tilt, you're gonna imagine that you got a big old belt buckle, or you're thinking about this front part of this band being pulled forward, okay? So watch my low back. As I tip forward, I'm gonna arch my back and my pelvis is gonna tip forward this direction. As I go into an anterior pelvic tilt, I want you to breathe in. I want you to inhale. So it's breathe in, tip forward, okay, and then we're going to do a posterior pelvic tilt, which is where the belt buckle here, or these straps, are going to go backwards. So we're going to tip our pelvis back and exhale, and that's going to be a posterior pelvic tilt. So we're going to do 10 of these nice and slow. I want you to think about moving from these muscles on the side of your abs. Those are going to be your obliques. That's going to help guide the movement, all right? So put one hand, if you're able, put one hand on your back, one hand on the belt buckle in front of you, and you're going to kind of go forward and back and help guide your brain in the direction it wants to go, all right? So sit up nice and tall. We're going to inhale and tip forward, okay? Ready? Inhale and forward. Now, exhale and back. Okay? Inhale and forward. Exhale and back. That's 2. Inhale forward. Exhale back. 3. Inhale forward. Exhale back. That's 4. Inhale forward. Exhale back. 5. Inhale forward. Exhale back. 6. Inhale forward. Exhale back. 7. Inhale forward. Exhale back. 8. Inhale forward. Exhale back. 9. Inhale forward. Exhale back. 10. Okay? Good job. All right, you can take your belt off. All right, so now the second exercise that we're going to do here is what's called a hip hike, all right? So we're gonna sit on the edge of our chair. If you need to be on the back of your chair, that's fine. Just don't lean back. Try to sit up tall. What we're gonna do here is we're gonna try to take this hip joint and we're gonna take this rib joint and we're gonna squeeze those together. So we're gonna kind of sit up nice and tall, and you can use your elbows to guide you. So you're gonna pull your right hip and your right rib together as your right elbow goes down. So it looks like this. So I'm gonna inhale and then I'm gonna exhale. And you want to drive down. So you can see this rib is being pulled in towards this hip, okay? And then come back to center. Inhale. Exhale, go to the other side. Inhale. Exhale. 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 One more each side. Inhale. exhale, inhale, and exhale, and relax. Okay, so that's it. That's how you start getting going on improving your hip mobility. So with those pelvic tilts, I recommend that you do between about 5 and 10 pelvic tilts. And then I recommend between about 10 and 20, okay, side to side hip hikes to really get that movement going. When we get front to back movement going and fed into the spine, and then we get side to side lateral movement fed into the spine and the pelvis, we really start to activate our SI joints, our pelvic stabilizers, our spine, our abs, our deep core, which is really gonna help start to restore those hip mobilizers. Good job, Jimmer. All right, so as you can see, those two pelvic movements really work some vital things. You got front back movement of the pelvis and you got side to side movement of the pelvis, which is really, really important to help restore the movement maps necessary for you to stand well, walk well, change direction, exercise better, all that kind of stuff. So you really want to practice these, practice them nice and slow, try to really connect in with the pelvis, feel it move, and don't try to rush through them. So this is part 1 of this series. Part 2, we're going to go into a really, really cool and very, very powerful hip strengthening exercise that's going to get your hips and your glutes stronger. So stay tuned for that. Tune in for that next time. And if you want more exercises like this, because this is just a very small snippet of what we do inside the MS Gym, besides learn how to speak, go ahead and click the link below in the text and we will hook you up with free exercises. So glad you were here for part 1. Tune in for part 2 and I will see you there.